This is Bloomberg Markets Balance of Power. I'm Sherry Yan in Washington.
And I'm David Weston here in New York. Republicans got only part of the way toward their goal last year of repealing Obamacare. But one of the things they did get done was eliminating the so-called individual mandate that penalized people for not signing up for health care insurance. Now that decision is getting some rethinking from an unexpected source. Dr. Tom Price served as HHS Secretary under President Trump after serving for 12 years as a Republican representing Georgia in the House of Representatives. Dr. Price is now Senior Health Care Fellow at the Job Creators Network, and he comes to us from Atlanta. Dr. Price, thank you so much for joining us today.
Thanks, David. Sherry, wonderful to be with you today.
So you gave a speech, and it got quite a fair amount of attention, I must say. And among other things, what you said is, there are many, this is about the individual mandate, there are many, and I'm one of them, who believes that that actually will harm the pool in the exchange market because you'll likely have individuals who are younger and healthier not participating in the market. Now that, to me at least, not understanding much about healthcare, makes good sense. If you eliminate some of the younger, more healthy people, it costs more. But that's what the Democrats were saying all along, and the Republicans are saying, no, we're going to get rid of it anyway. Where are you?
Yeah, no. Well, the individual mandate, repealing the individual mandate is important, and it was a commendable thing to do because mandates for health care actually force people to buy things that they don't want, and they drive up costs and lower choices, decrease the number of choices. What I said, and you identified it appropriately, in that pool, so in that exchange market, when you remove some individuals, it affects the cost for other folks. And absent other reforms, which is the key, which I also said during those remarks, absent other reforms, it changes the price. So those other reforms are important to look at, and that's why I'm so excited about what the Department of Labor is doing in the area of association health plans to give individuals in small businesses and elsewhere in that individual and small group market the opportunity to purchase the kind of coverage that they want, not that the government forces them to buy.
And we want to talk about those changes, but just before we do that, one last thing here. Again, for somebody who's not a student of this, why is this different from uninsured motorist requirements? And we require people to pay money into a pool in each state to cover uninsured motorists if we don't have separate insurance. Why is this any different from that?
Yeah, it's a little broader discussion, but it may be appropriate to encourage individuals to have insurance, health insurance. That's wise. We want everybody to be covered. But the important thing is that we want folks to select the kind of coverage that they want for themselves and for their family, not that the government forces them to buy. And that's where the ACA, that's where Obamacare got off on the wrong foot, because it said, we, the federal government, know best for you, the American people. So much so that over 3 million individuals paid a penalty, paid a tax, a fine for the privilege of not buying health coverage. That's a program that may work for the government, it may work for insurance companies, but it doesn't work for people. And that's why, again, I'm so excited about what Job Creators Network is doing in the area of association health plans and encouraging the ability for folks in small business, which is one of the areas where we've seen a remarkable decrease in the number of folks being covered with health coverage because of the costs and the decrease in choices.
Will that do anything with the rising insurance premiums? Because Republicans will have to face that challenge during the midterm elections.
Well, this is one of the problems, Sherry, as you correctly identified, and that is premiums are up and choices are down, and that's a direct result of the Affordable Care Act. That's a direct result of the law. So when you aren't able to have an overall comprehensive reform, which is what the House passed actually, and the Senate was unable to get done, when you're unable to get that through the Congress, then the consequences are that you have to live with what exists, and that's again why we continue to need appropriate reforms. We need the kinds of things that Job Creators Network and association health plans will put in place, and that the Department of Labor is working on with a new rule that's likely to come out within the next month or so. This is really exciting information because it would allow folks in small business and their employees to pool together, to gather together solely for the purpose of purchasing health coverage, which is not possible right now. That ought to decrease costs, increase choices, and be much more responsive to the individual.
In the meantime, though, insurance premiums will rise, and you've written on your op-ed that Democrats plan to blame the Obamacare death spiral on Republicans' repeal of the individual mandate. So how do you cope with the results so far going into November?
Well, again, would that we would be able to have a conversation about health care that wasn't politicized, but that doesn't seem to be possible right now in our nation. But sadly, what we're living with are the effects of the ACA, of Obamacare, again, driving up premiums, driving up deductibles, lowering choices for folks, so much so that again, I practiced medicine for over 20 years. Many of my colleagues tell me now that there are patients that they have who come into their office for whom there is recommended a procedure or something to be done, and they say, I'm sorry, I can't do that for myself or for my child because I can't afford the deductible. This is not a system, again, that's working for patients, and that's the key. We've got to get a system that's working for patients, and association health plans, the kinds of things that Job Creators Network is working on are so important and will truly move us in the direction of a positive solution to get many more folks covered. You know, David and Sherry, there are still 28 million individuals in this nation who don't have health coverage. Some folks on the other side seem to act like everybody's got coverage and it's all hunky-dory right now. Well, the fact of the matter is there are a lot that don't, and we need new viable solutions.
Well, exactly, and that's what I'd like to talk about, the people who don't have coverage, because love it or hate it, Obamacare did increase the number of people with health care coverage. That is now reversing again. Will these association health plans take up that slack or even go beyond? How is that going to work?
Well, I think so. There are easily somewhere around 15 to 20 million and maybe even more individuals out there who would like a much more responsive plan for themselves or can't afford. As I think I mentioned, small businesses, which create more jobs for Americans than anybody else. 2/3 of the jobs, new jobs being created, are through small businesses. And the number of small businesses that have decreased, have not provided coverage for health coverage for their employees between 2005 and 2015, decreased by 1/3. So over 1/3 of individuals got out of the business of providing coverage for their employees. That's not because they don't want to. It's because it costs too much or the choices are too few. So what the association health plans will do, again, this potential rule coming from the Department of Labor, strongly supported by Job Creators Network, what it will do is provide more choices, lowering the costs for individuals, and make it so that the plans are much more responsive to the end user, the patient, and that's what's important.
So, and Doctor, I understand why you object to the government deciding how this works, but Obamacare at the very least provided health care for a lot of other people and required them, yes, required them to have it. How long will it take for this private alternative to kick back in and reverse the trend now in health care coverage?
Well, it can happen really quickly, and you're right. There was an increase in the coverage that came about through the ACA, through Obamacare, but it was an increase in coverage again that has so many people covered who then can't afford the care that they need because the premiums have significantly increased and the deductibles are through the roof. So next year, again, as a result of the ACA, as a result of Obamacare, the average premium increase in the benchmark plan, this is through the Obamacare plans, is 36%. Some states it's over 50%. Some states it's pushing 100%. That's again a plan that doesn't work for individuals. So what we need to do is to find those kinds of solutions that will allow for folks to buy the kind of coverage that they want for themselves and for their families. And that's the whole purpose of Job Creators Network working to ensure that association health plans move forward in a positive way.
Dr. Price, finally, let me ask you about you leaving HHS after criticism over spending. What do you make of the current allegations against the EPA Administrator, Scott Pruitt?
Yeah, I can't tell you what a privilege it was for me to be able to serve the American people as Health and Human Secretary, even for a short period of time. And the 80,000 individuals at the department who work tirelessly, day in and day out, to try to improve the health and well-being of the American people. It was just an incredible privilege for me, and that's how I'd like to answer that question.
Do you think it distracts from actual policy?
Well, again, I'll leave that for others to decide. I'm happily trying to continue to be a positive and productive voice in the area of health care and look forward to working with anybody who wants to truly solve problems.
Dr. Price, thank you so much for your time today. Dr. Tom Price, former HHS Secretary and Senior Health Care Fellow at the Job Creators Network. Coming up, a record number of women are running for public office. Why that may not translate into gains in Congress? That story next. This is Bloomberg.